So you are welcome to this presentation. Good morning to you. I hope you're doing well. So let's start this presentation. We are going to look at preconception care, which is basically care that is provided to partners before the woman conceives. So it involves a number of interventions ranging from biomedical tests, behavior modification, a number of social interventions. So the aim of this care is basically to make sure that there is reduction in the risk factors that can lead to poor maternal and child health outcomes. So it is aimed at making sure that these risks are removed, and when they are removed, it reduces the chances of mortality or complications, birth defects, infections, and transmission of infections from the mother to the unborn child or the yet to be conceived baby. So it is very important that couples are involved in prenatal care because of the reasons that are put across. Poor maternal or child health outcomes can happen. Okay, and when we talk about that, we mean issues of maternal mortality, child mortality, occurrence of unwanted pregnancies, or even complications. The infant or the child health outcomes include issues to do with having a stillbirth, preterm birth, low birth weight, birth defects. These are all poor child health outcomes, and also other things that can result into poor maternal and even infant health outcomes include issues to do with chronic diseases that the mother may be having, issues like diabetes type 2, cardiovascular diseases. These will also reduce or will contribute to poor maternal and child poor outcomes. Okay, so the interest, therefore, is to make sure that we reduce the things that cause poor maternal and child health outcomes. So what are those considerations that we really need to focus on? There are quite many, and then we are going to look at each of those in the context of preconception care. So the first, of course, is nutrition. The woman has to make sure that she has optimal weight and body mass index. This is very important because they have influence on maternal health outcomes and even child health outcomes. The issues that we focus on here are related to nutritional deficiencies, issues that are related to eating disorders. These are the areas of focus. There are specific nutrients that we need to have to boost the chances of fertility. Remember, preconception care is before the woman conceives. Okay. So before the woman conceives, we are focused on making sure that she can actually conceive if she wants to. That is fertility. So certain nutrients are very, very important in boosting our fertility. And these include what you can call micronutrients, zinc, vitamins, magnesium, selenium, and then these bulk foods, what you can call macronutrients, fats, proteins, and also fiber. These are very important because they can actually boost fertility. So the woman also needs to take foods that contain folic, like legumes, peas, grains, cereals, nuts, fruits, and leafy vegetables. These are important sources of folic acid. Folic acid is very important in preventing the neural tube defects, what you call spina bifida, and also will prevent recurrent miscarriages. The foods that we take may not contain sufficient folic acid that is actually required, but we can take supplementation of folic acid to compensate for that, or to top up on what we get from the diet. We also need sufficient iron stores to meet the needs of the fetus, and the sources of iron can be meat, poultry, fish, leafy green, and then also iron-enriched grains. If we have deficiency of iron, anemia will happen. That will complicate delivery because the person will have less blood. Okay, so usually that's an individual could be taking less iron, or if they're taking the iron is not being absorbed properly, and therefore we have what you call reduced bioavailability. Sometimes parasites can deplete iron. Even malaria parasites actually deplete, can cause anemia. It's also very important to carry out a number of tests. These tests are very key because they provide valuable information about the risk of having a child with a genetic disorder. Having a child with a genetic disorder can have a lot of impact on the family. So it is very important to discuss issues related to genetic makeup. Checking for sickle cell is very key because we can have individuals who are having the sickle cell trait, and if they get married, it is their chances that they can have one or more of their children having sickle cell disease, and that can be something difficult. So if the woman has chronic conditions such as diabetes, hypertension, thyroid disorders, it is very important that these conditions are actually managed before pregnancy. These conditions can be worsened by these conditions can be worsened. The pregnancy can worsen these conditions, okay? And then this can bring issues to the mother and also the baby. There are some vaccines or medications that have to be taken during pregnancy. An example can be the anti-D. For a woman who is rhesus negative and the person they are intending to have the child with is rhesus positive, they can have a child who is rhesus positive, and this can result into what we call the hemolytic disease of the newborn. So it is very important that this is actually managed by giving anti-D. Before conception. So medications can have effects on the fetus. So it is very important that these are actually discussed before a woman can conceive. So this is basically to look at the alternative medicines that can be given or other treatment options, such that the delivery is actually the pregnancy and delivery are not complicated by the medications. Mental health and well-being are very important. Pregnancies can actually be associated with mental disorders such as what we call postpartum depression or postpartum blues. Okay, so before the woman conceives, it's very important that these mental issues are actually discussed and addressed. Sexual health should be discussed. Okay, sexual health should be discussed, and also contraception. It is very important to start thinking about the contraception methods in advance before conception. So tests can be run, including tests for HIV, genetic testing, as we have just discussed, and then issues to do with hormonal level assessments. The family is very key, so they need to be engaged, such that they can support the woman during the pregnancy journey. The man or the partner is actually very key because it plays an important role in preconception care. Other aspects that are also very important is that the woman has to avoid some of the lifestyle activities such as smoking. Smoking is associated with a number of complications such as preterm birth, low birth weight, and then we also have issues to do with alcohol consumption. Alcohol also will result into what we call fetal alcohol spectrum disorders. These have a lot of impact on the physical, behavior, and learning disabilities in a child. So pregnant, for those who want to get pregnant, should avoid alcohol. And then drug use, illicit drugs should be avoided because they also cause risks. The woman should be encouraged to participate in physical activity, stress management, and also avoid exposures to toxins that can cause complications in pregnancy. So that marks the end of our presentation. Thank you for joining.